All right, let's jump right in. Today, we're going to talk about something that is, well, literally a matter of life and death. The hidden dangers you'd never expect that are lurking in the smoke of a regular old house fire. When you picture a fire, what do you see? Flames, right? Big, scary flames. But let me ask you this. What's the real killer? The answer, well, it might just surprise you. Because, yeah, the fire itself is terrifying, no doubt, but there's often something way more insidious, way sneakier at work, an invisible threat that can incapacitate a person long before the flames even get close. So, okay, let's get into what's actually in all that smoke. It isn't just ash and soot. It's a toxic, invisible cocktail, a really dangerous chemical soup. Now, we've all heard about carbon monoxide, the so-called silent killer, but it often has a partner in crime, a poison that's even faster and, frankly, more sinister, one that attacks your body at the cellular level. And that brings us to the main villain of our story today, cyanide. And nope, this is not something out of a spy movie. It's a chemical that gets produced when the most common everyday items in our homes start to burn. Scientifically, it's known as hydrogen cyanide, or HCN. It's created whenever materials that contain nitrogen burn without enough oxygen, which, if you think about it, is the exact definition of a smoldering house fire, even one that's just down to embers. And just look at where this stuff comes from. This is the crazy part. We're talking about plastics, vinyl flooring, furniture, even natural things like wool rugs and silk curtains. It's the stuff that we're all surrounded by every single day, turning into little poison factories. So here's the crucial part. Here's how this tiny molecule attacks. It's lipid soluble, which is a fancy way of saying it can dissolve in fat. That means it can slip through our cell walls with terrifying speed. And once it's inside, it's like it just flicks an off switch, shutting down the cell's ability to use oxygen and produce energy. The whole system just grinds to a halt. Now, let's put ourselves in the shoes of a first responder. They arrive on the scene of a fire. It's chaotic, there's a victim who's unconscious, and it's a frantic race against the clock. They have to solve this incredibly high-stakes diagnostic puzzle, and they have to do it now. They can't just treat the obvious burns. They have to play detective and look for a very specific pattern of symptoms, a constellation of clues that all point to this invisible poison doing its damage. And this is basically their mental checklist. They're looking for 4 key signs. First, dyspnea. Is the patient struggling to breathe? Second, hypotension. Is their blood pressure just totally tanked? Third, dysrhythmias. Is their heart rhythm all over the place? And finally, are they confused or unconscious? If the answers are yes, 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 and yes, cyanide becomes a primary suspect. But this is where science offers a truly incredible solution. I mean, it's just amazing. There is an antidote, and it works in this fascinating, almost elegant way. This is so cool. Okay, on the left, you've got the problem. Cyanide locks up the cell, stopping it from using oxygen. But on the right, you've got the solution, a compound called hydroxocobalamin. It enters the system, it finds the cyanide, and it literally binds to it, creating a new, totally harmless molecule that the body can just get rid of. It's like a chemical escort that grabs the bad guy and walks it right out the door. And get this, the side effects are as dramatic as the cure itself. The antidote is intensely red, so it actually turns the patient's skin and their urine red. Now, it might look alarming, but this color change is actually a powerful visual sign for the medical team that the life-saving medicine is coursing through the body, doing its job. So how do first responders get this miracle cure into the patient fast enough to actually make a difference? It's a very precise rapid-fire procedure. The process is broken down into 3 critical steps. First, they reconstitute the powdered antidote with saline. Second, they have to mix it, gently rocking it, never shaking, for a full minute. And finally, it's infused directly into the bloodstream through an IV. And the speed here is absolutely critical. The entire life-saving dose is administered in just 15 minutes. In the world of emergency medicine, that is incredibly fast, and it just speaks to the urgency of reversing the poison's effects. Of course, it's important to remember that this antidote is part of a much bigger effort. Administering it never delays the absolute basics, like making sure the patient has a clear airway and is getting oxygen. It's one powerful tool in the larger life support toolkit. Ultimately, it all comes down to this remarkable fact. This is the power of biochemistry in action, a scientific intervention that transforms a lethal poison, a cellular assassin,
into a harmless substance that the body can simply and safely get rid of. It's an absolutely incredible turnaround.
So we'll leave you with this one question. After seeing how everyday materials can become so dangerous in a fire, what's in your home? It's a sobering thought, for sure, but just understanding this invisible risk is the first and most important step. Thanks for joining us.